Attorney knows best. Intelligent interviews. Interesting insight. Intriguing information. Attorney knows best. Here's your host, Sean Bartley.
Thanks for listening to AttorneyKnowsBest.com. If you hadn't heard, I'm using Anchor.fm to record this podcast. Anchor is the easiest way to make a podcast. Let me explain. First, Anchor.fm is free. That's right, totally free. There's creation tools that allow you to record and edit your podcast right from your phone or your computer. Anchor will then distribute your podcast for you so it can be heard on Spotify, Apple Podcast, and many more. I listen to my podcasts on Google Podcast. You can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. Download the free Anchor app now or go to anchor.fm to get started. That's ANCHOR.FM to get started. Back to the podcast. Thanks for listening.
Good afternoon or good morning or good night, wherever you may be. This is Sean Bartley with another episode of Attorney Knows Best. Currently, as you know, we're in a pandemic situation with the Corona-19 virus. And today we have the pleasure of speaking with a very important person who works for the Public Health Foundation located here in Washington, D.C. His name is Ron Bialek. Thanks for joining us today, Ron.
Thank you so much, Sean. It's a pleasure.
How are you surviving the pandemic?
Well, cooped up in my home for one thing, and organizationally, you know, we're all moving forward. Right. We're sprinting, and our colleagues are sprinting.
Right. I was excited when I learned about your organization and your work. We were talking at a common event that we both attend, and I was excited to meet you because public health is something I always took for granted as a youth, and then when I had children, I understood the importance of public health. And so with the Corona virus, the COVID-19 virus, plaguing the world right now, and especially our cities and our country, I was excited to talk to you about, you know, your work in public health and the importance of your work. Tell us a little bit about your background. Where'd you go to school, and why'd you get involved in public health?
Well, actually, I was really interested in policy and politics. That was where I started. I went to school at Johns Hopkins, did my undergraduate work there in poli-sci, and later on went back there for a public policy degree. And what got me involved in public health was my mentor in my master's program said, "So Ron, what are you interested in?" And I said, "I'm interested in politics, policy, economics, and health." And she said, "Perfect. You want to do public health." and my response to her was I don't want to be a nurse. Because I didn't understand what public health was all about. And then she really helped me understand it and started doing some work in that area.
That's why I think this conversation is important. A lot of people don't know what public health is, and I'm speaking generally because I do some work in public health for a nonprofit. And when I explain to folks what I do and what our organization is about, the light bulb goes off. But for our audience, what is public health, and how would you define it?
Well, a lot of people think of public health as the safety net, and certainly that is a role that we play and have played, but we do so much more. And I often go back to looking at what CEA Winslow said 100 years ago. He was the person who started the first, or one of the first, academic programs in public health at Yale. And what he said, and in his definition of public health, is that it's the science and the art of preventing disease, prolonging life, and promoting health. And that's done throughout a community. Mm-hmm. And that's what we're really all about. And when we get into, governmental public health, well, governmental public health is really the one entity charged with protecting and promoting the health of communities.
Now, do you work
more than?
Go ahead.
No, I was going to say more than individuals.
Do you work for the Public Health Foundation in public health, and if you were to define it succinctly in an elevator speech, if somebody said, "Hey, you work for the Public Health Foundation, what is public health?" How would you define it quickly in an elevator?
Yeah, I would say what we do is work towards improving the performance of individuals and organizations who are protecting and promoting the health of communities.
So it's not necessarily like the free clinic where you go get a checkup or a shot, but it's more so with the performance of those facilities, correct?
It's investigating emerging diseases. It's understanding the health needs of a community. It's preventing the spread of disease. It's assuring safe drinking water and food, preventing child lead poisoning, things of that nature, all encompass public health. Not the clinic. The clinic is really a small part of public health.
Okay. I had a difficulty wrapping my head around public health at first when I first got started in it. And on a nonprofit side, I worked for an organization where we were interested in development of children prior to them entering school life, and also helping families navigating public health issues like mental health, wellness, childhood brain development. And so the public health aspect touches all our communities and all our lives, especially in well-traveled countries like the United States. Describe how you deliver public health services.
How we as an organization?
Yeah, as an organization.
Well, we work a lot with state, tribal, local, and territorial health departments around the country. And there are thousands of local health departments, for instance, and many tribal public health agencies. And those organizations are people-oriented. And what we do is we try to provide them with the skills and the capabilities and the training and the technical support to look at what they're doing and really employ continuous improvement methods and techniques, but also make sure they have access to the science that helps them do the work they need to do. With COVID, that's been a perfect example where, the science is changing so rapidly. You want to be sure that those who are out there protecting, promoting the public health have access to that information.
So with
the organizations themselves, if we take Montgomery County, for instance, our county, their staff is out there. Part of it is they do restaurant inspections. Part of it is they work with a variety of players, the clinics, the hospitals, and others, to better understand the patient mix and what's going on within the county. They'll work with police and fire to see what's going on with regard to public safety. In terms of preparedness, that's part of what they'll do as well. So it's a real comprehensive approach and a holistic approach to the health of the community.
Right. Explain the Public Health Foundation. I did some research on it, and it looks like a large, interesting, and dynamic organization. Explain what you all do and how you do it effectively.
Well, thank you. I appreciate that compliment. We think of ourselves as large in impact and relatively small in terms of numbers of people. So we have a core staff of 15.
Okay.
And we work with consultants in the field as well. What we do to assure that we have the impact around the nation, and actually we do some work internationally, is that we have things like our Train Learning Network that we created now about 17 years ago, and that serves over 3 million users.
Wow.
About 1 million in healthcare, 300,000 in governmental public health, preparedness, private sector. And what that does is it makes thousands of trainings available to anybody, and those trainings, 97% of them are free. And
Wow.
Anybody in the world can use the system. So that's just one way that we do it. We try to be creative and make connections of resources to people. And connecting the dots is a lot of what we do, and facilitating conversations is a lot of what we do.
Have you used your train system to help implement COVID-19 remedies or solutions?
Absolutely. When it was declared a pandemic, we immediately went into action at the Public Health Foundation. We had our trained staff, we had our staff, and actually it was all hands on deck, quite frankly. And we began looking what already existed within the train network that could be leveraged and help people with the pandemic. And then we began looking at what were the training needs in the field. So we put our tentacles out to the practitioners in the field. As we learned about the training needs, we began to bring in additional training from organizations like the Centers for Disease Control and Prevention, World Health Organization, Johns Hopkins University, and others who had training that we could then put into the system. We have to date over 300 COVID-19 related trainings.
Wow.
And right now with the vaccination, we have 30 trainings. And we developed a training plan with the Centers for Disease Control and Prevention for those who are new as vaccinators, because we need a larger workforce to vaccinate every American.
Well, explain how that works.
To do that, they need training.
How's that work? So a person who's never given a vaccination before can go to the Public Health Foundation and go through your train system and learn how to do vaccinations in their own organizations?
Well, it's not quite that way, because there are a whole variety of legal requirements.
Right.
That
can't just be any Joe Schmo. Right.
Right.
Okay.
So they have to be, they're organizations that are approved to do this. But you can train people. Community health workers, for instance, can be trained to do this. We know that in pharmacies, right, there are vaccinations given there. It has to be done properly. The handling of this vaccine has to be done properly. Whether it's Moderna or the Pfizer vaccine, it's a complex process. But yes, the trainings are available there. So, our first example with that is with contact tracing, where that was ramping up in communities. And, how do we quickly train people? And again, we had a lot of contact tracing training in there so that these new people to the public health workforce could be trained rapidly. And then the organizations they were working for would have their processes to assess that the individuals have learned what they need to learn.
In our pre-interview, you discussed how you developed a system to distribute the COVID-19 vaccine. Can you discuss that here and how you all developed the training to transport and or implement facilities doling out the vaccine?
Well, so on the dissemination side, what we've done is assist CDC with some of the elements of that. So, for instance, with the Pfizer vaccine, dry ice. Like, we never thought we'd be in the dry ice business in public health.
Right.
Well, all of a sudden, the clinics, the health departments, the hospitals, the nursing homes, the pharmacies would be receiving these packages of vials packed in dry ice. How do they handle them properly? What do they do with it? So we worked with CDC to develop a dry ice fact sheet. We contacted the American Association of, or it's the Association of American Veterinary Medical Association, and the Association of Public Health Laboratories, because they deal with super cold, super frozen vials and specimens. And we worked with them to better understand how to handle this. One of the realities is that most of us who've handled dry ice, when my refrigerator's gone out, when Pepco stops working properly, right? I get the dry ice, I put it in the freezer.
Okay.
Keep the refrigerator going. Well, we know we use thick gloves for that to keep ourselves safe. Well, we use thick gloves to remove the dry ice from the Pfizer boxes, but now you have to handle these little vials. So now you have to switch to thinner gloves, smaller gloves, and you need to protect the workers. You need to protect the vials. You don't want to drop them. So it's a really complex process. So our role in this was twofold: to develop fact sheets like that, and secondly, to provide the training about the processes for dissemination, for storage, for transport of the vaccine. And all of that was done in collaboration with CDC. And we were very fortunate also. Pfizer let us into their system prior to release of the vaccine so that we could learn more about just the packaging of it. Mm-hmm. So we could provide guidance.
Wow, that's really dynamic and important. Had you all ever done anything like this before with vaccines on a lesser scale but important?
So we work with a part of CDC that's in charge of working on vaccines, and we provide some communications assistance to them, but nothing of this magnitude before. What's been gratifying is that the partnership and the trust that mm-hmm. exists has led to our mutual ability to respond quickly.
Did the SARS virus prepare you for this, or did you all do anything with regards to the SARS virus when that struck?
We provided some information, but nothing, mm-hmm. again, like this. Really what prepared us for it is if we go back to 9/11.
Okay.
So what happened following 9/11 was we were hearing from our community that, hey, maybe we need to train people better. And that's when we started what became our Train Learning Network, what I had mentioned about 3 million learners. Had we not built that then, had we not built it in the way that we built it, and that was meant to be a hub and a collective rather than, single individual systems for every state, had we not built it and built it the way we did, we would not have been prepared to respond this way with COVID.
Were you with the Public Health Foundation when 9/11 happened?
Yes, I remember it all quite well. I've been with the Public Health Foundation now for 25 years.
Wow. And I think the Public Health Foundation's been around since 1970, correct?
Yeah, we're a 50-year-old group.
Right, 50-year-old group. And this is the first time this is the first time many Americans have dealt with a pandemic of this nature. But did you ever deal with virus outbreaks like Ebola in Africa or the SARS virus in Asia and learn from them to implement your strategies here in the United States?
Absolutely. So with Ebola, when CDC started sending some of their staff over to Africa to deal with the virus, they needed to be sure that their folks were trained properly. So we worked with CDC to have the training within the Train Learning Network to be able to see that those individuals who were being sent over took the training, successfully completed the training so that they knew when they got on the ground that they'd actually be able to do the work and do it properly. And that really did help us for COVID as well, because we could see how well we could track people and report on it in real time.
Mm-hmm. The devastation of COVID-19 is something that has me concerned as a parent and as a business owner with people that I'm responsible for and their work and getting things done, and then clients that we have to service. How do you all balance the needs of the community and the anxieties that the community has when dealing with COVID-19? Do you all deal with mental health issues?
We've dealt far less with the mental health issues.
Mm-hmm.
And, there's a whole, there's so many different aspects of this. And what you're talking about is, I think of empathy.
Mm-hmm.
We sometimes you hear people talk about the anti-vaxxers, for instance, right? And of course there's anxiety over that. And you hear the terms of vaccine hesitancy. Well, one of the things that we've had to learn in public health is to empathize. If you don't listen, if you don't hear the person on the other end and the anxieties they have, you can't get to where you want to ultimately go. It's not the solution to everything, but too often there is the you're right, you're wrong, that's it. And one of the approaches that we've taken in public health is let's listen to the different sides of the story. That hasn't always happened, and I think one of the problems we've had is we've never had an issue where our public health professionals have been attacked.
Mm-hmm.
Almost on a daily basis. Harassed, fired, people showing up to their homes to protest, and that results in just, I don't know, more everybody sort of digging in, taking sides. And we've had to play a lot of defense at a time when we have professionals who've dedicated their lives pretty much to protecting and promoting the public's health. And they're now being attacked for doing that. So it's been a real difficult time, and people are exhausted as well. I know, Sean, I didn't really get to your question.
That's okay.
But there's really a lot of empathy that's needed.
Yeah, I mean, sometimes my questioning is more out of curiosity, right? And so sometimes I'm curious as to, what an organization does, and so I might ask an offbeat question from time to time. But there are things that I think about, and I'm sure there are things that you think about as the responsible individual for the Public Health Foundation and being successful in what you do. And so when we look at COVID-19, are there any particular success stories that you're proud of that the Public Health Foundation was able to accomplish?
Well, I'm proud of a number of things. One is, I'll again go back to the training that we've quickly made available. We've put together live searches on a variety of topic areas like vaccinations, like contact tracing, like PPE. And to date, we've had about 500,000 courses taken through our train learning system. And we know that those are having a direct impact of those working in the field, because we have a lot of data that we can track through the system to see that, yes, there are some people taking training who are curious. The vast majority of people taking training are actually working in public health and healthcare and addressing this directly. So that's one real success. And another is also leveraging what we've learned in the past in quality improvement. So back in H1N1 days.
That's one I forgot about, H1N1.
Yeah. H1N1, we did some quality improvement work with health departments on their clinics to provide tools where they each day could use some very basic quality improvement tools to assess how well it's going and to make immediate improvements. It's just a very relatively simple tool. It's called the Start, Stop, Continue matrix. What should we stop doing? What should we continue doing? And what do we need to improve? By using that, we saw dramatic improvements to those clinic settings and to the clinic flows and to consumer satisfaction with the clinics. We've taken that and we've now sort of repackaged it, if you will, to help those doing vaccination clinics now to see that while there are differences with H1N1 and COVID, in terms of things like clinic flow and making improvements, we're trying to encourage folks to do that on a daily basis because they can. And we've also recently put together another quality improvement tool that looks at how to prevent wasted vaccine, how to anticipate the unexpected, prepare for it so you can mitigate it.
Wasted vaccine. Yeah, that's an interesting topic because I think there was a story in Philadelphia a week or two ago where the person that they put in charge of vaccine distributions in Philadelphia had no experience. And because of his youth and immaturity, it looked as though he had a waste vaccine problem or a preference problem, and he took the vaccine home to give to his friends. That was almost unheard of. What do you do to combat people who are misusing the resources that that they receive? I know you're not a government agency, you're a nonprofit. We'll get to the importance of that. But what do you do to help combat something like that?
I mean, fortunately, it's not rampant. And the incident in Wisconsin where somebody intentionally disposed of the vaccine.
The pharmacist, yeah.
Right. And law enforcement has intervened there. There's only so much you can do to prevent. And I would say that when you look at our public health agencies and the vaccine going to our health departments, I haven't heard of any instances of abuse or misuse with the vaccine going to our governmental public health agencies. Yeah, the effort nationally had really not been coordinated. So that leads to, too many opportunities for things to go wrong.
Too many opportunities for things to go wrong. And then your organization is in place to prevent things from going wrong. And I think you're doing an effective job with it based on our conversations that we've had. Now, explain the role between a nonprofit and a government agency. How does that relationship work?
Well, I mean, the government agency has its particular rules and regulations it needs to follow. If you look at the federal government, right, CDC can do what Congress mandates CDC to do. We as a nonprofit have a mission similar to a federal agency potentially, and we have the flexibility to do our work a bit more independently than a federal agency. So we have funding from CDC, but we have funding from states. We have funding from a variety of different sources. So we can have greater flexibility. We can be a bit more nimble. We don't have to necessarily go through all of the bureaucratic processes to respond quickly. And sometimes government agencies do look to nonprofits to be able to fill some of the gaps and respond more quickly than they may be able to do. Another part of it is we have relationships that we've built up around the country with organizations, and those relationships and the trust that's developed there and the ability and the experience to work together really enables you to take action, again, with something like COVID.
Yeah, I can only imagine the difficulties in being a government agency and a nonprofit, because you are charged with can do, right? So you're more outcome-based and you're more focused on getting the job done as opposed to playing politics and making sure that the correct manager gets credit and that you have the correct people signing off. I think the flexibility and mobility of nonprofits are important. Does the government fund your work?
So we have, I'd say, about maybe a quarter of our funding comes from the government, the federal government. And then we have a substantial amount of funding from state health departments and some local health departments as well, and then some foundations. I mean, during COVID, we were very fortunate that we responded quickly. We knew that we could only go so far, and then we were able to acquire funds, grant funds from both the CDC Foundation and from the Pfizer Foundation. And their contributions have enabled us to continue our COVID response work. CDC itself also enabled us to reprogram some of their funding to allow us to respond to the pandemic.
Does your organization provide boots on the ground in the clinics or just the information required by the clinics to get the work done?
I would say the boots on the ground goes only as far as going into the field and providing on-site training for individuals. So a lot of our quality improvement and performance management training will be with the staff within an organization, helping them develop some quality improvement initiatives and projects and helping them implement that. And at times we also will work with community coalitions and facilitate that process and help them come together in a way where they can, at the end of the day, become less competitive and see how their pieces can fit together to achieve a particular end. So how it fits together versus somebody taking something away from them.
I smiled because when you said less competitive, the opportunity and dollars are limited in the nonprofit world, and sometimes you're competing for the same dollar. You're wanting to provide a solution for the same cause or issue, but there is a competition from time to time between nonprofits, and I think you're doing something really important when you're trying to have those nonprofits work with one another rather than competing. But competition is also key in public health, because when we look at the vaccines that have come about for COVID-19, that competition is healthy and that competition is good. Does the Public Health Foundation foster any competition with other nonprofits, and does it benefit Public Health Foundation?
Yeah, it's funny that you ask that. We often use the term as we're competitive collaborators.
Mm-hmm.
Because we do recognize with many other organizations with whom we work that we do indeed at times compete for the same dollars.
Mm-hmm.
Part of our feeling about that is let the best organization do the work. It's okay to have competition. We had lots of competition, over the years around our Train Learning Network. What did that do? It resulted in us improving it because we needed to keep growing it. We needed to keep improving it so that it would continue to be used and be useful. So, when there's a level playing field and fairness in terms of how one is funded based upon experience, expertise, vision, etc., I think it can work quite well. We've often also said, let's provide our governmental public health agencies with more funding so that they can purchase services like ours.
Mm-hmm.
And if we do it well, they'll purchase it from us. If somebody else does it better, they'll purchase it from them. Let them make the decision based upon who they think can best meet their needs.
That's it. That's an interesting way to look at it, because in my experience with some nonprofits, I don't want anybody else to win because it can mean, number one, it can mean loss and opportunity for the people who work for your particular foundation. And then two, it can, the other organization might not do it as well as you. And I think that's noble that you do it,
Mm-hmm.
that you have that attitude.
We actually try to identify our niche. When we entered into workforce development, quality improvement, and performance management, really there was nobody dealing with that in public health. And we decided, let's focus there, let's develop expertise there, let's publish there, let's have our reputation be there. And that's one way to avoid the competition, is to find a niche and really focus there and become the best you possibly can there.
Do you have an example of where people have used your resources and substantially improved their clinic and or healthcare delivery services? So an example would be somebody was not effective in giving out early childhood immunizations, and you all stepped in, introduced them to the TRAIN program, and now they're doing an effective job of it, and you're meeting community needs. Or, there's various examples I'm sure you could give.
Yeah, no, I'm thinking about an initiative we had a number of years ago with a health department in Florida, where, excuse me, their sexually transmitted diseases rates, their syphilis rates were increasing rapidly. And they didn't really understand what was going on, and they brought us in to do some quality improvement work with them. And we worked with their nurses, their physicians, their outreach workers, and others. And at the end of the day, they saw it was more than a 50% drop in the syphilis rates within about a 6-month period.
Wow.
Well, what was behind that? The real interesting part of that story is that when we got there, they all had their answers about what to do. And we said, you know what? Check your answers at the door. Let's go through this process and see if we can identify the root causes. And as we went through that, what became apparent was the health department, that part of the health department was not a fun place to work. There was a lot of gossip. There was backstabbing.
Wow.
And there was incredible turnover. So what would happen is people would come in, they'd be trained on the right processes, and then they'd be gone. And then you'd have new people who didn't know the processes that were needed to be used for contact tracing and syphilis prevention and treatment, etc. So once they recognized the morale problems there, and once they fixed it, the retention rate went up to about 100%, and their syphilis rates dropped by over 50%.
Wow. That's interesting. So like community spread dropped, or their effective treatment of the disease?
Both dropped, because what was happening was people who had syphilis would transmit it to others and others and others, and the contact tracing and the processes for reducing the transmission that could be done were not being implemented.
Wow.
And once they started doing that, they saw a tremendous drop. So that's the one that comes to mind, just because it's such an unusual case where we have a slide that we say the number one cause of syphilis in that county is gossip.
I would think gossip would stop the spread.
Right. Yeah. So it was an interesting one.
Yeah, that's interesting. Not to laugh about syphilis or anything.
And if I may give something more current that really is near and dear, because we think today a lot about social justice, we think about systemic racism, we think about these issues that are impacting people every day. We were brought into Milwaukee because their childhood lead poisoning program really wasn't doing the best it could. Mm-hmm. And in Milwaukee, there was some research done that 50% of the individuals incarcerated for gun violence, 50% of them had lead poisoning as children.
Wow.
And the vast majority of individuals with lead poisoning in Milwaukee they're black and brown. Mm-hmm. They're living in conditions that are not suitable for healthy living. And kids were getting, and still getting, lead poisoning from housing. Mm-hmm. So we were brought in to work with them and to really look at the program. And as a result, they've made some major changes. The county council, or the city council, it's called the Common Council, has added additional funding, but not just throw money at the problem. Put money there, put people there, put oversight there to really make those improvements. And we'll be going back in about a year to see what's happened. The comptroller's office is the one who actually hired us to do this. And but it's a good example of what an outside organization that has the skills and capability can do within a jurisdiction to really make a difference, and a difference that gets to the crux of really social justice and racism.
Well, can you make it plain, the connection between lead poisoning and gun violence? I think there's that needs to be spelled out. So lead poisoning does what to an individual that may lead them?
So lead poisoning can dramatically impact IQ, can create learning disabilities, contribute to things of ADD, and so individuals who are far less able to learn may not, they won't learn, necessarily stay in school, have disabilities that lead them astray, and end up in jail. And it just ends up being that gun violence was pretty prevalent in Milwaukee, and that while we don't know cause and effect, we do know there are correlations of those individuals who are in jail.
Right. So lead inhibits cognitive development and/or brain development, correct?
Correct.
And so
Correct.
as a result, those with lesser developed cognitive abilities or brains might have a tendency towards violence. And I think there's a real connection to it.
Well, and not only that, so let's say the individuals who don't become violent,
Mm-hmm.
Their ability to succeed and, earn a living wage, they may have a lifelong disability, and that just keeps people who are impoverished, keeps them there.
Mm-hmm.
And that's what I talk about in terms of, social justice and systemic racism, is that if children aren't given a chance, if they are lead poisoned and they have cognitive impairment for the rest of their lives, the likelihood that they're going to get out of poverty, well, maybe they will. Maybe they'll be fortunate enough, but the likelihood is much lower than somebody who's never had lead poisoning.
Right. So what steps will you all take to help reduce lead poisoning in the Milwaukee communities?
Well, it was everything from when they go in and find a child with lead poisoning, okay, to appropriately treat that so that it doesn't become worse, to increasing the amount of home inspections
Mm-hmm.
to prevent lead poisoning from the get-go, to, when we had gotten in there, the first thing was that there were cases that hadn't been followed up with for years.
Mm-hmm.
And really just working with the staff there, designing the policies and processes that they can follow to do the job that needs to be done. Now, the team that we put together, we have people who actually reduce lead poisoning in jurisdictions where they have worked as health officials in the past. So they had some experience with knowing what can work and how well it can work.
Wow. So from like a communicable disease to environmental conditions and causes, public health encompasses both. That's fascinating. How do you balance it all? I mean, it's like a transmittable disease to an environmental condition. That's a big chasm between those two issues, I think.
Well, if we go back to the purpose of public health and what a public health agency is supposed to do, is they're supposed to protect and promote the health within the community.
Mm-hmm.
And so they have to look at this more holistically. But you raise a good point, because there's so much. How do you focus? And now we're increasingly being seen as responsible for social determinants of health. So having adequate food, access to healthy foods, to people having adequate housing, to having jobs. Well, we can't ourselves impact those. So there's a concept now out there where we're looking at the public health officials in a community acting more as a conductor
Mm-hmm.
of an orchestra. And the players in the orchestra, the businesses, the schools, the hospitals, the clinics, they're all members of the orchestra. And what needs to happen at the community level is you need to have a good conductor. And that conductor can ultimately make beautiful music, right? And so if we see our roles as trying to pull those pieces together and trying to get to the beautiful music stage, that's where you can really make a difference in community health. So we can't do it all.
Mm-hmm.
And increasingly looking at that facilitation role and pulling those pieces together.
Let's get back to COVID-19, because that is, I hate to say it, I think I suffered from anxiety early on from COVID-19 and how it was going to be combated and how we were going to be able to live our workaday lives and our family lives with COVID-19. And that's the pressing issue of the day. What do you see in the future with regards to containing and controlling COVID-19, and what role will the Public Health Foundation play in that?
Wow.
I mean, it's important.
Small
I mean,
question.
like we need to get it under control to get back to our normal lives. If there's going to be a normal, a return to normal, or is there going to be a new normal? And what role will the Public Health Foundation play in that?
So I will be an optimist for a moment.
Okay.
I'm optimistic that the vaccines are and will continue to be effective. I'm optimistic that the technologies being used for the vaccines will be able to deal with the variants. So it may be that we are required to get boosters yearly or periodically. And if that's what we live with, that's okay. And I believe that those who who have not yet been convinced that they should be vaccinated, that I think over time, working with community organizations, working with individuals, working with the faith community, that we'll get there.
Mm-hmm.
So, but in the meantime, if we look at this again as a communal effort and that we all need to be responsible for one another, masks. Masks are important. Had we done that from the very beginning, I don't think we would be where we are today.
Yeah,
the problems that we're seeing.
Mask, right?
You got your mask.
Yeah, I go to the restroom, I have my mask on. Yeah. I interact with my colleagues, I have my mask on.
So I'll tell you what we're seeing right now is that yes, we do see that progress is being made, and we do see an end in sight, not around the corner, a little bit, around a couple of blocks. What we have to do, though, is seize on the moment to beef up our public health system. And that's what we're working towards with our colleagues. There is legislation that's being introduced in Congress for infusing, $4.5 billion into public health. It's only $13 per person. And when we look at the trillions that we've spent and continue to spend and the lives we've lost, it's not a big investment. If we do things right, and that's what we're working towards, to build public health for the future, not go back to where we were, then I think we have a bright future. I often like to think of the state of public health at the beginning of the pandemic as being the broken down firehouse.
Okay.
With maybe a broken down fire truck or no fire trucks, and one person who periodically checks in to the firehouse to see if anything's falling apart. And I think about if that existed in my own community, if that was our firehouse, and then there's a fire, and you say, okay, what are we going to do? Oh, well, let's hire firefighters, let's get the equipment and whatnot. And you do that. Well, the house is already burned down.
Right.
And that's what happened with the pandemic, is where our public health agencies have been neglected and could not possibly respond in a way that they needed to respond because of that neglect. And so our role as a public health foundation and our role with our colleagues is to do the best that we can to assure that that doesn't happen again. So we'll be beyond the pandemic, and now we have to be prepared for whatever comes next. And we can be, and we should have been.
Yeah, I think one of the issues that I know we're going to need Public Health Foundation on is trust and confidence, especially amongst black and brown people, based upon the United States history of experimenting on black and brown people. Mm-hmm. And right now I have some family and friends who are African American that are reluctant to take the vaccine, and they publicly stated, no, we're going to sit this round out and we're going to wait until the next round. And their reasoning is based upon what happened with the Tuskegee, quote unquote, experiment, right, and the distrust of the government and experimentation on African American people. Are you all helping restore or build public trust in people going out and getting the vaccine?
Yeah, we are now doing some work with CDC and potentially some work with some other organizations. We actually will be working on some proposals mm-hmm. for fairly immediate funding to work towards building confidence in the vaccine.
I think that's going to be important in combating it and getting what you call booster shots. Like you got the first set of shots, the virus is mutated, and now you need a booster shot. I think building public trust, especially with the most affected communities, African Americans and Latino communities, I think it's going to be really important.
And what becomes key is for us to provide the information, the training, and the tools for those who are in the communities who can help to build that trust. It's not going to be the Public Health Foundation. It's not going to be the governmental agencies. It's going to be the people who live there. Mm-hmm. It's going to be the people who the neighbor trusts. It's going to be the again, whether it's the church, whether it's the barber, whether it's, it doesn't matter. We have to get to the people who others in the community trust and provide those individuals with the information that they can use with their neighbors, with their colleagues, with their families. Mm-hmm. So that's what a key role is for us, and we've begun that process of communications.
Mm-hmm. I'm a communication major and a lawyer, and people often ask me, what does communications have to do with the law? and I never know how to answer that. But I think Public Health Foundation communication is key. How much time do you all spend on making sure your communications are effective, and do you have to specifically tailor it for certain groups of people?
Oh boy!
I know. I mean, but
we.
So I mean, it may be a difficult question because I know you focus on licensed professionals or skilled labor, right? So do you have to tailor your message differently for those people?
Well, yes, you definitely have to tailor messages differently for different types of professionals mm-hmm. and volunteers and individuals in the community. Our focus is to try to equip those who are working in the field to have the information to convey to others. So, but again, the messaging is quite different, and then even language. We were recognizing, if you go back to contact tracing for a moment, we were recognizing that if you provide all the training in English, that's not necessarily going to be helpful to a number of Spanish-speaking individuals who are contact tracers working with Spanish-speaking populations.
Right.
Right. And so we went out looking for training that was in Spanish that we could add to train. So that the messaging has so many different aspects to it. We again like to think of ourselves working with those who are the true communicators, people who are very skilled in communications, and provide them with the information that they can use and that they can tailor to the audiences that they're speaking with. We may not be tailoring it for those audiences, but we need to provide that information to those who do tailor it. Does that make any sense?
It does make sense because as a lawyer, I run into an issue from time to time where I have to back up from using legalese and try to use metaphors to explain the legal process or my client's position with regards to a legal issue. And I can't use the same language that I would use in speaking with a colleague, another lawyer, or the court, and I have to explain it to my client in layman's terms, so to speak. Or if I have a new receptionist or if I have a new law clerk, sometimes I can't use the same language with those quasi-legal professionals that I would use with a certified legal professional. And I'm sure you all have the same issue. I mean, when I look at the Florida case, you had, several communication phases and styles that you had to deal with. You had to deal with the office, how you deal with those people, how you deal with the professionals, and then the community, right? So that was
Right.
very complex, you know.
Yep. No, as you've been speaking, I've been thinking of all sorts of different situations that deal with approaches for communication. We're right now working with CDC on a infographic dealing with anaphylaxis. Well,
What is
what's
anaphylaxis?
That is you've heard about reactions to the COVID vaccine.
Oh, like an
shock.
allergic reaction.
Yeah,
Okay.
allergic. Right.
Okay.
Well, it turns out, a lot of the pharmacies and pharmacists where the vaccine is being administered, they really don't have experience with that. So what do they do? So, working with CDC, putting together an infographic to a very simple, one pager with pictures and words to help the pharmacies and pharmacists have the information that they need. Well, I'll tell you, when I look at it, it's not something that appeals to me, but I'm not a pharmacist. I'm not a pharmacy professional. So we have to gear the messaging and the infographic to those who are going to be using it, not to what appeals to me. Mm-hmm. I'm not going to be out there doing the vaccinations. So communications and tailoring is so key.
Very key. Our conversation has been wide-ranging today and circuitous at times, because that's just
that's public health.
Yeah. That's just my question and answer style. I jump all around. But if someone's listening today and they're an undergrad or they're in high school and they're looking and exploring a career and they were considering public health, what would be the three most important things you could share with them?
Well, I'd say first, it's not the pay, it's the passion. A rewarding profession. And you're surrounded by smart people, by enjoyable people, by dedicated people. Second, I'd say, if you're a clinician and you enjoy treating individuals one by one, public health may not necessarily be for you. However, if you're really interested in treating an entire community and working with the health of an entire jurisdiction, it is a profession for you. And lastly, I would say if you love learning and if you always want to be learning, public health is continuous learning because it involves working with people and perspectives and behaviors, things that are continuously changing. Mm-hmm. So you have to continuously learn and change what you do at the same time.
Wow. I think the continuously learning part is so cogent, especially with the COVID-19 crisis. You all had to learn to deal with a new virulent disease, and now you have to learn and translate how to help people deliver the vaccines. That's amazing.
It's a great profession. I'm delighted that I finally found it.
Yeah. It's so you didn't start in public health. You started after your master's work, right? So
Right. Before that, I was, I wanted to work on the Hill mm-hmm. for my congressional representative. I started working with volunteering for him when I was 12, and he guaranteed me a job on the Hill when I graduated.
Wow, what was his name?
Lester Wolf.
Okay, don't know Lester. Is he Marylander or?
No. I grew up on Long Island.
Oh,
and,
you grew up on Long Island.
He was a congressional representative in Nassau County and Queens. Okay. A good guy, and he lost when I was a junior.
Oh.
So I had no job on the Hill. I had to get a real job.
No job on the Hill. But I mean, we could go into this, but time is winding down. But I'm sure your Public Health Foundation does have a legislative outreach arm also, right?
We don't do lobbying.
Oh, you don't do lobbying. Nonprofit,
but we do,
501c can't do lobbying.
But we do educate.
Mm-hmm. You do educate.
And again, part of our job is to provide the information that can help those who are making decisions make the best decisions they can make.
Right. If someone listening wants to utilize your great train system tool, how would they go about getting in contact with your organization to become qualified to use it?
Very simple. Train.org.
TRAIN.org?
Train, like the choo-choo train? Right.
Right.
Train.org. That is it. And that will get them to the system, and they can register. There's no restrictions. Anybody, anywhere in the world can become a user. It's free.
3 million
And
people
if they
so
want
far. Yeah.
Yep. And if they want to come learn more about PHF, it's just PHF for Public Health Foundation.org.
Right. And they can reach out to your great organization and learn how to deliver services to those in need, especially during the COVID-19 coronavirus pandemic. Do you have any questions for me? I always like to give my guests an opportunity to ask me a question because I'm so nosy.
Oh my goodness.
So to speak. I don't often let people ask me questions because I'm the questioner.
Wow. I wish you had told me that in advance. I would have thought of something.
Well, that's good. I'm off the hook.
So why do you do these podcasts?
Why do I do the podcast? Yeah, so number one, I majored in communications in college. And then number two, I am forever curious. And I read constantly. My wife always goes, "Why are you always on the phone? What are you doing? We're here." And I'm like, "I'm reading a news article." And she's like, "No, you're not reading the news article." So when we were talking about the vaccine delivery, I was able to recall the pharmacist in Milwaukee and then the kid in Philadelphia because I read about it. I didn't even do it in preparation for this, but I'm always reading and I'm always able to connect the dots with various information that I receive. And so I'm quite curious. I grew up listening to talk radio. My dad was a big talk radio fan in Los Angeles, California. And talk radio, I think the pioneering cities for talk radio were New York City and Los Angeles, California. And there was a fine radio station, AM station called 790 KABC, and they had great talk shows. And my dad listened to talk shows all the time. And I had endeavored to do that, but I got scared. Because everybody told me how hard of a life it was to be in radio and TV. And so I didn't pursue it. And so, but, I mean, I can go to a cocktail party. I mean, you probably, I mean, I know all about Ron's son, who's an Alaska adventurer, right? And so we're at this really important meeting, and I'm talking to Ron about his son and all the things his son does, his photography, his hunting, his fishing, right? So I like to talk and I like to learn about people. And so the podcast is all about me learning about people and sharing my curiosity with the audience so that if they're curious but too shy to ask questions, they have an attorney that can do it for them. And so that's why I do the podcast.
Love it.
Yep.
That's great.
Yep. And so now I know more about you. And unfortunately, Ron, I might remember everything you said today.
Oh my goodness, I'm in trouble.
No, you said, I mean, it's great information, but I just can't get it off my brain sometimes. Sometimes I remember everything, sometimes I don't. But I think it was important for me to talk to you about public health because I'm involved in public health and I'm still learning. I'm not a trained professional in it, but I know how important it is and that people sometimes associate like free medical insurance or free medical coverage with public health, but they're two different things, but they're both important. And people neglect public health until everybody's sick. And they're like, I don't want this person near me. Why didn't you take care of this person who had tuberculosis or COVID-19? Everybody's concerned about public health because we want to be healthy.
Well, just remember that the healthcare dollar, 3 cents of every healthcare dollar goes to public health. That's it.
That's it.
And
wow.
Public health needs to prevent. Yep. And that's it. And that's one of the problems is that we invest in fixing things after they're broken.
Mm-hmm. Yep. I could talk to you all day, especially about like, disparities in healthcare, the negative effects of common ailments that can be cured in communities that go left unchecked like syphilis, but thank God you're there. Hey, I thank you so much for joining us today. And thank you for being flexible and answering my wide-ranging question and answer style. It's effective for cross-examination and trials, by the way.
Well, Sean, thank you so much. I really appreciate this opportunity, and you probably could tell I love talking about public health.
Yep, it's awesome, and I thank you for sharing with us and me. Thanks, Ron.
Thank you.
Have a great one.
You too.